All right, this young man right away, we can see a sway back.
Yeah, we sure can. And he's young.
Anterior pelvic tilt.
Yes. Why don't you draw us the line with a really obvious rotation? And the rotation is even showing in the feet, which is awesome.
Hmm.
You can see right there the right heel. We can actually see the right heel popping behind the left.
Oh, wow, right there.
Mm-hmm. Just a little stagger, no big deal, but it's consistent. So it already, immediately I'm like, okay, we got a young guy, we got a twist. I wonder, do they skateboard? Do they snowboard? Do they have a twisted activity? Because it's always good to know. Or no, but we can see in the legs, the right leg is strongly externally rotated compared to the left. I mean, they're both having a day at the racetracks here.
See, I see bow legs, but
Okay.
you see
I'll,
something else, right?
um, a lot of times we might call it tibia torsion
Mm,
because if his feet were straight, he wouldn't be bow-legged anymore. He would be internally rotated. But something is holding the top of his leg straight. So the bottom is bowing. So it's a tibia torsion because the whole bow-legged really does look like a fellow who's gotten off of a horse. It should go all the way through the leg, and then the legs are very straight. A lot of runners kind of sometimes are bow-legged, ironically, because they can cross the midline really easily. This person has probably got very tight hamstrings or tight something that's pulling the pelvis into position with a lot of force. And there's your hip lift rotation.
yeah.
I'd love to know if this person skateboards or something. I only say that I had a snowboarder who hurt himself when he fell twisted because his feet were locked in. And I'm always curious. And there is your shoulder blade. So this gentleman has rounded shoulders, heavy rounded shoulders, like a strong deficiency in the shoulder girdle. Big
Mm.
time. But I don't know why. So those are your tips of your scapula. So when they pop up, if you can imagine the scapula, it's a little triangle on your back.
Right.
And when it starts to tip and actually protrude off of your body, there's a muscle group or many muscles that aren't doing their job.
Right.
And he might have fake flexibility. I don't know. But he might be somebody who could get himself in some trouble going to work out and then like repeatedly hurting himself.
And
I
we
don't
we
know.
we got a bigger arm window over here on the left too.
Yep, he's rotated. Right,
Yeah.
that's the left side. So he's heavy. He's got a right, the right foot kind of lingers back a tidge bit and lifts up.
It's fascinating.
But I'd be curious. But he is somebody who just get his legs straight, get his shoulders back over his hips, and he's good to go.
Yeah. And he's so young, he's gonna bounce
Yeah,
right back,
but
especially if he's, doing the right nutrition too.
right. But here, there's just such a deficiency here on the right side because the hip isn't really supporting him.
It's a big anterior pelvic tilt.
It's huge.
Look at that.
But it's because his bum is working really hard. His deep
Yes.
rotators are working really hard as well.
Right.
I mean,
Right.
it's good, it's strong. His bum is doing its job.
Look
But
at the
then on
Lord.
the other side, it's not doing the same job. I mean, you can really see the distinction in the back there. It's just not doing the same thing at all.
A lot of
It's
lordosis here.
uncomfortable.
His
Yeah.
arm is covering it, but
Yeah. No, doesn't it look uncomfortable on that side? A little
it
bit like
does.
somebody like startled him and he went, oh!
Right.
The
Right.
other side, it's like, this is my leg.
Right.
And it shows in his stance.
Now, can you take us inside the body and show us some things?
I wanted to look at his shoulder. And the reason I want to look at his shoulder is because his positioning, no offense, dude, is really poor. But I like being able to show what we can do with that. So you can see this okay, Dr. Reese? Yeah,
Yes.
good. All right. So we all do this. People understand. I want you to focus on this right here, this moving person. When you don't have proper shoulder stabilizers, so maybe we send you some exercises and they're really basic. They're like pullovers, like you're not doing these big movements. And a lot of people are like, I need more weight. I need more. This gentleman we're even looking at, he doesn't have the stability in the shoulder, like the side with the green check. The muscle groups are supporting the lifting and lowering of that weight. It's going to reboot. So just let it rock and roll. Great place to learn about things for yourself, guys, as well. Hands off. And I'll just stop him right there. Boom. That's neutral. Across here, neutral. This person can't sustain that. So the gentleman in front of us has a bit of this problem. He also looks flexible with the swayback. So he's going to do all sorts of different things to make his arms work and move. We might give him some of just these basics. We want this to reconstruct. We want this to reconstruct, right? But right now he's got a lot of movement because those tips are actually off of his body. So he's somebody who might be like, I'm going to go do a bunch of shoulder work, do it the whole time with poor posture and think he's doing a great job, but probably go beyond the range of motion because this whole stability that is required isn't there. And it goes into overmobility, which for him translates into the low back.
Right.
Right. So it's just a really good idea to understand, you know, here's your shoulder joint. This is the actual movement part. And then everything else is muscle, posture. So if we don't have good posture under the motion, well, we suffer.
Right.
As you know yourself, with a bit of a head forward position, being a computer athlete, the shoulders just
up and down.
creep. They creep. They just, and then all of a sudden you're like, what happened? You know, and then immediately everyone's like, oh, I got to get my shoulders down my back. But by that point, I'm sorry, it's too late. You need to do something before that. You need to probably get your pelvis all situated. You might need to look at your head position. So I love posture therapy for that because chest up, shoulders back, it won't work. It's a lovely idea, but it just doesn't work unless you understand chest up, shoulders back, rib cage over pelvis, pelvis in neutral, head over neutral pelvis, knees going forward, feet going down. You know, like there's a mantra. There's a lot more than just one thing. It's never one.
Well, we can get this kid corrected. He needs some postural therapy. He needs some nutrition. If anyone's out there that wants a free P-Ray exam like we do here, just go to peaceoverpain.com and we will take care of you. You just submit your photos and we're on our way.